I'm Matt Flanagan and I head up Back to Health, and we specialise in providing postural corrective care for our patients. Being able to show patients what's wrong and then the need to correct it and inspire them towards taking responsibility for their health has always been a bit of an issue because it's always been out of sight, out of mind. At Back to Health, we've had a technological revolution to address some of the most fundamental issues facing healthcare practitioners. So in practice, what we do is after taking the x-rays, we measure up all of the angles of the spine, and then we import that information into virtual reality. So it really means that we can give a very realistic impression of exactly what we're seeing on the x-rays. Millie, nice to meet you.
Nice to meet you. I've come to Back to Health today to see what sort of health my spine is in.
This is going to be something different, something you've never experienced before, a completely different way of looking at your spine.
When I was a bit younger, I just kept breaking bones. You know, I broke my wrist, I broke my ankle.
Just have a stand there facing that way for me.
And then having tests at the hospital, we realised I had the bones of a 50, 60-year-old woman at the age of 21. So I've come along today to really see what the state of my spine is and what can be done.
What we're really looking for is to identify the areas of where your spine is outside of the safe zones, and then look at it in 3 dimensions. We're going to go into virtual reality and show you how your spine's misaligned.
One of the reasons why virtual reality may enhance learning is that it makes people learn through a more vivid and rich visual image, and that has been shown to improve memory as compared to a situation where the visual image is like an x-ray.
Pop those over your eyes there. So from the front.
I'm so wonky.
And this is what's really important. One of the big challenges for patients is to understand how they're misaligned. Because your spine is misaligned, that is going to slightly change your balance. What we'd want to do is try and correct your spine first, to do it in a safe way.
Oh, that's fascinating. Actually seeing your spine so misaligned with the normal spine behind it. So now I'll actually be able to take control of my health again and do something about it. Whether it's in this setting or at home or at work, I've got to really keep thinking about this and how to manage it and how to make it better.
The ability to be able to see really in a 3D way what a normal spine would look like and what their own spine looks like, to understand what modifications they can make. I just think that is incredibly powerful.
Tom.
Hey Matt, how you doing?
You all right?
I'm good, you?
Good to see you. Come on through. Well, it's been 18 months since you started treatment. Tell us a little bit about your experience before you came into Back to Health and how coming here and perhaps changed the way you were thinking about your health.
Probably been struggling for eight-ish months. I got injured over Christmas at work. It was horrible. I was basically living on the floor. I was living on a yoga mat. Anything I did would heighten the pain. You know, even eating and drinking I wasn't really interested in. So I went through several months of going to different places and trying to find out what was wrong with me. They take your x-ray, they check you out, but they don't show you anything. They kind of feel like you're just being palmed from one person to the other. I just wasn't getting better, essentially.
How would you describe the use of virtual reality and how that has helped you understand your problems?
Looking at the x-rays, I'm listening to what you're saying, but when you talk about the degrees, all I'm thinking is, okay, I'm a mess. But when you see the VR, you can see much more going on, and you've got the layers as well, so you can see what's affecting what. That enables you to have a much more thorough understanding of what you're dealing with and what you need to do yourself. There was a point when I really didn't think I was going to get better. About 3-4 months into the treatment, I was starting to sleep better, walk better, feel better, and even just how my interactions with people, even people in the street, in the shops, it was bigger, brighter. I'm back on my feet, so to speak.
This is just the beginning with virtual reality. Already we've seen patients' lives are changing in a way that we've never seen before. Patients are able to understand their problems in a way they've never known before, and we're seeing much better results than we've ever seen. We're really excited about the future of virtual reality and how we can communicate with patients better than ever before.